So far, we have studied several things from this chapter, including introduction part, the different stages of CKD patient, investigations done in case of CKD patients, how do we monitor, what are the different, what is the guideline for monitoring CKD patient. The next heading is pathophysiology of anemia in CKD. So, like I mentioned before, the most common cause or the most prominent cause for anemia in CKD is EPO deficiency. But there are other causes also. So let us go through step by step. First is erythropoietic profile in case of CKD. The erythropoietic profile is normocytic, normochromic morphology is there. There is normal MCV, but there is low retic count. There is absence of polychromasia on peripheral blood smear. The major factor in anemia of CKD patient is failure to normal erythropoietin response or progressive reduction in endogenous EPO levels. There are certain contributing factors such as reduced iron level due to blood loss or impaired iron absorption, increased hepcidin levels which lead to impaired use of iron stores, systemic inflammation and associated comorbidities such as diabetes mellitus, hyporesponsive bone marrow to EPO due to uremic toxin, decreased RBC lifespan, and deficiency states such as vitamin B12 or folic acid deficiency. So these are the additional contributing factors which might lead to anemia in CKD patient. So let us first discuss what is EPO. So EPO is a glycoprotein. It is produced mainly in kidney interstitial peritubular cells. This was one of the MCQ that was asked a few years ago in NEET SS exam, that from where EPO is produced. So it is produced mainly in kidney peritubular cells and in lesser amount in liver. Even in that lesser amount, the majority of part is produced in hepatocyte and few EPO is produced in eto cells. The production of EPO depends upon the tissue oxygen tension. Kidneys are more sensitive to low oxygen tension for EPO production compared to liver. Plasma half-life of kidney-produced EPO is 5 to 6 hours. It regulates erythropoiesis through receptor binding and signal transduction pathway. Now, what is this receptor? This receptor is called as EPO receptor. It is present on erythroid progenitor cells or the precursor cells such as BFUE or CFUE. Primary target cell is CFUE as it is responsive to small amounts of EPO. When EPO bind to its receptor, it autophosphorylates JAK2 that ultimately inhibit the progenitor cell, the apoptosis of progenitor cells via multiple regulatory pathways such as STAT pathway, PI3K pathway, or AKT pathway. It is controlled by transcription factor GATA1, which increases erythropoiesis during differentiation. So this EPO is produced by EPO gene that is located on chromosome number 7. Transcription activated by HIF1, that is hypoxia induced factor 1. This HIF1 also activate genes like VEGF, PDGF, glycolytic enzymes. So a few points about HIF1 which are important. These are HIF1 constitutes two subunit HIF1 alpha and HIF1 beta. Generally, this HIF1 beta, it is constitutively expressed, but HIF1 alpha, it is hydroxylated by HIF prolyl hydroxylase enzyme. In short, it is written as PhD. We will see this term again, so please remember this. So I was saying HIF1 alpha, it is hydroxylated by HIF prolyl hydroxylase enzyme PhD under normal oxygen tension. That is, in case of normoxia, HIF1 alpha is bound by VHL E3 ubiquitin ligase and degraded. If there is an hypoxia, in case of hypoxia, hypoxia prevents the action of PhD. This action is inhibited in case of hypoxia that leads to accumulation of HIF1 alpha. This HIF1 alpha, it translocates inside the nucleus and binds to HIF1 beta. The HIF1 alpha beta heterodimer, it binds to something called as HRE, that is hypoxia responsive elements on DNA. They regulate upregulation and downregulation of these hypoxia sensitive genes. So that's all for this session. We will continue our discussion on anemia in CKD in the upcoming videos. Hello friends. So if you have watched my video till here, it means I assume that you like this lesson and you want to learn it seriously. So I have created a course on recent advances for hematology. I would like you to check out that course where I have discussed all chapters in detail using different books, and I have written notes in a simplified way. Link would be in the description. Please do check it out. Thank you.